Hi, Alliance members. This is Newell Augur coming to you from Augusta with this week's report ending or about to end on February 9th. We had a lot of interesting things took place this week. First and foremost among them was that Vicki, Molly, and I did get our chance to meet with Senator Troy Jackson, who is the minority leader of the Democrats in the Senate. Had a great meeting with him. He and his caucus have indicated they're squarely behind making sure that we get that increase for the second year of the biennium. If you'll recall, Senator Jackson actually proposed a bill last year, LD 1466, which proposed a number of different increases along the whole long-term care continuum, including increases to adult day, to PNMI rates, to assisted living, some other nursing home reimbursement adjustments. And that bill had a price tag of about $26 million. It's been pared down quite a bit, but that bill is still up for consideration, along with Representative Espling's bill, which is the bill that would provide us specifically the additional increase. Again, we're not taking a position on how it's done. We just want to make sure that it is done before they leave in April. It is kind of interesting, though. You're starting to see some of the positioning by Democrats and Republicans on how these budget bills are going to be allocated. And the Republicans are probably not in as much of a rush to get that done, because if it is done sooner, that's going to leave more time and more money on the table to address the Medicaid expansion bill, which the voters passed in November, which the Republicans, for the most part, and certainly the governor, are opposed to. And they're going to want to drag that out, most likely, so that it's going to be more difficult to fund that to the end of the session. We obviously do not want to get involved in any of those discussions or any of those battles in any way, shape, or form, and we've tried to make that point very clearly to as many people as we can. One thing that will change is we're going to start to be reaching out to members of the Appropriations Committee. So those of you who are in Oxford or Bangor or Kennebunk or Scarborough or Eagle Lake, where members of the Appropriations Committee sit, we're going to start reaching out to you and hopefully having you come to Augusta so we can sit down with members of the Appropriations Committee and make sure that they know and hear our interest in making sure we get that piece of money for the second part of the biennium. Outside of the issue of home-based care, we have marijuana, which seems to be highlighting the news every day. The House Republicans voted against extending the moratorium. It was somewhat puzzling to a lot of people who were following this, including other Republicans in the Senate. But as a practical matter, it really doesn't change much, even though the law that was passed by the voters 2 years ago effectively is now the law of the state. There's no way to get a license to sell marijuana, and all of the other license structures for large-scale growing aren't in effect because the licenses haven't been issued. So it really hasn't changed anything in the short term. But what we are hearing is that medical patients at dispensaries are starting to leave those businesses and growing it on their own, or getting it from others who are growing it for them, either through the caregiver model or under the table. And that's obviously something of a growing concern. There is also, related to your businesses, there is a bill that Senator Amy Volk put in before the Labor, Commerce, Research and Economic Development Committee to change the way in which, make it easier, if you will, for employers to do drug testing of employees. It would lower the threshold from 50 to 10 numbers of employees that you would have to have a drug testing option. It would get rid of the requirement that you have to have a written policy. It would get rid of the requirement that there be probable cause. Labor is obviously opposed to that, and not the least of which is because some of the mandated proposals to assist the EAP program, once you find someone with a drug addiction, would go away. The bill was tabled today in the LCRAD, or yesterday, And so there may be some room for some discussion about that. Obviously, the hospitals have a real interest in that as well, given all the drugs they have within their facilities. So more to come on that. Also, interestingly, the LCRED committee took up the issue of the minimum wage, and that hearing on reducing the speed with which the minimum wage is implemented was also debated and discussed today. The Republicans support a proposal to, instead of going up $1 in each of the next 2 years, to go up 50 cents for the next 4 years, and then include the indexing in 2023. The Democrats, not surprisingly, are opposed to that. There may be some Democrats in the House who would support such a proposal. That's going to be an interesting discussion, and we'll wait and see how that plays out, because I'm quite sure that folks at the AFL-CIO and some of the other organizations that were supportive of that referendum are going to be very interested in keeping the language just exactly where it is. Also, there's been a lot of discussion on the opioid task force, which presented some of their findings to a number of different committees today. There seems to be a real interest in trying to find more opioid health homes, if you will, so people who have been through their recovery be able to find places for them to go after they're done so they don't relapse. And there are, interestingly, a number of pockets around the state, the Mid-Coast being one of them, where even though the relapse levels are high, because of a couple programs there, they have less of a fatality rate, quite frankly, from people who have successfully completed an opioid treatment program and are now trying to put their lives back together and do that in a safe, stable, sober environment. That's about all I've got for now. But and I'm sorry the Patriots lost, Ken. But hopefully next year they'll have all 4 of their defensive backfield ready to play for the Super Bowl. Talk to you soon. Have a great week. And the governor's state of the state is next Tuesday, so stay tuned for that.